Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness in Glen, Illinois. I have my lovely patient Linda with me today, and we're going to show you how to do Voluma and Volbella. So we're doing some filler. And it's been about 9.5, 10 months since we've done filler before. We did one Voluma, one Volbella. And you think it was before that?
I thought it was before the wedding.
When was the wedding?
September?
Yeah, no, I have January 9th of 2020. We did some.
Maybe.
We might have done some. We might have done some sooner too. But anyway, so it hasn't been that long. But what, obviously, as with everybody, we don't want to put a whole bunch of filler in. And so doing a little at a time is actually a great way to do filler. So before we get started, Linda, I'm going to hand you the mirror.
Mm-hmm.
And what bothers you? Like,
this part.
Okay.
My jowls bother me, and I just feel like my face is. I feel like people think I'm sad.
Okay.
Everything's kind of droopy.
Okay. So as we age, we do get droopy. Our face droops down a little bit. Mm-hmm. So we're losing bone mass, we're losing muscle mass, and then of course we're losing our collagen and elastin, which is creating the droop, what you're feeling. Mm-hmm. So Linda has a little bit of topical on. We've already cleaned her off. We use some Hibiclens to clean her as well. I'm just cleaning a little with some alcohol. And then I just want to go through the facial structures a little bit and talk about the approach. So as she mentioned, she feels like she's drooping down, which again is very normal, the progression of aging. So what we're going to do is we're actually going to come back here and give a little bit of lift. And that's going to be really nice because you can see the difference under the eye a little bit. She's a little bit flat through here, but not too bad. But you can see the pull through here. Can you see that okay, Steph? Since she did one in January, there's no way we're going to be doing two anyway. I think we've always only done
We're very
one.
conservative, which
Yes,
is what I like.
Yes, very conservative because we really just want to look perked up. We don't want to look overdone. So again, this is Voluma Juvederm. It's a Juvederm product. I always say Juvederm is the first name. Voluma, Volbella, Volure, and Ultra are the last names of our Juvederm products. Juvederm is the fillers are all hyaluronic acids, and what that means is that's a naturally occurring product that's in our body anyway, so our body breaks this down very naturally over time. With Voluma, which you're right on track, I usually say when we do one syringe, 9 to 12 months is when you want to do it again. When we do two syringes at the same time, which the majority of the people need, then we say 12 to 15 months before we do it again. But sometimes when people are really depleted, we'll add a third syringe 3 months, 6 months down the road. Okay. Really, it's not like, as long as we're looking natural, it's not like it's ever going to be too much. I mean, I did 5 syringes on a patient the other day. She probably could have used 2 more. So she was in her 70s, and I usually will say you need a syringe for every decade. So she was in her 70s, I did 5.
I'm doing good then.
You're doing great. That's right. But the other thing, let's talk about the other thing, because you take care of your skin.
Oh, absolutely.
You do all of the Skin Medica products. Mm-hmm. You've been on our TNS for as long as I've known you. Mm-hmm. Yeah, so probably 10 years, probably as long as I've been on it. You do, I think you've done L-therapy a few times.
I've done it once.
One time, okay. Secret. You did Secret.
Secret RF. I love it, love it, love it.
Good. And so what those do, they stimulate collagen. So like she said, she's really in great shape because her overall picture, the skin is very healthy.
Care of my skin, yes.
Yes, and she's very good about using her color science products.
And our sunscreen.
That's right. So, okay.
And that's why I have a skin cancer thing. That's why that's low there. He had to take it out.
Oh, okay. Okay. So that's exactly what I said. It's a little depleted. So we'll fix that too. So, okay, you ready? Okay. So with Voluma, so we just put it in, and then it'll just lift that skin beautifully. And I like my Juvederm products because they're safe, meaning I can aspirate every time I inject and make sure I'm not at any vessels. Everybody needs to understand that filler is a medical procedure, and it's not something that you want to mess around with. So, I mean, that tiny little bit, I don't know if you can see the difference, but I was saying that her cheekbone was so high here, so by putting this back here, it actually created a better looking cheekbone. So that's what I love about it too, is that, so you compare the sides. Can you see that? If you compare here and then right here, you can see just a little difference. It's very slight, but that's what I love about it, is that a little goes a long way. So anyway, so it's a medical procedure, so we really want to make sure that when we're going to clinics that it's a reputable clinic and we're using product from the U.S. We're not sharing syringes, all that kind of stuff. Very good. Does it hurt?
No.
Okay.
Not at all.
Okay. And you've done, how many secret RFs have you done?
3.
1.
Maybe not even a month, I think I got.
Oh, okay, good.
So no, that's not true. I did it in July.
In July.
In June.
Okay.
June, yeah.
I know this year is flying by so much. It's hard. Would you? That's okay. I was just gonna have you be my alcohol, if you don't mind. Not my drinking alcohol, my alcohol swabs.
I'm going to jump in.
Yeah, no, you're fine.
I was come at 4 o'clock. Happy hour.
That's right. Happy hour. It's happy hour Voluma. So okay, so I'm really digging that. I'm gonna put just a touch more up above. And then we'll jump to the other side.
I don't know why I'm closing my eyes, but I feel the need to.
Oh yeah, it's fine. Honestly, I prefer it. It's kind of funny because some people have their eyes open and it freaks me out. So keep your eyes closed. Because I just don't really love being injected. And so...
But you can't really feel it, but no, I'm staying away with dental work.
Yes. Okay, so this is looking absolutely gorgeous. Look at the difference just through here. Now granted, we already knew she was a little flatter there, but it's just pulling up beautifully.
Yeah.
Yep. So if you've ever been to our office, you'll notice that the decoration changes all the time, and Linda helps us out with that. She is a genius when it comes to decorating.
Thank you.
And I did not text you. I love the decorations you did over the weekend for Halloween and fall. I mean, I just love it. It's gorgeous.
Just a little bit.
So, yeah. Okay, so if you hand me them, Mia, please.
Of course.
Thanks. So let's see what you think. See if you can tell a difference there.
Oh yeah, it is raising it up already.
Yeah, and it's very, very slight.
That looks good.
And it's not quite a half syringe, but I'm gonna go ahead and go to the other side. Okay, now if you'll swing around with me this way. This is the side I was telling her I'm having a need an assistant. Thanks. Okay. But anyway, back to Secret. I know we're doing filler, but back to Secret. She still doesn't have all her, the final results on what it's gonna look like as far as her skin tightening. So it's a deep microneedling with radio frequency, and the radio frequency is heat energy that stimulates collagen. Turn this on. And Linda already has she has a heart shape face anyway, which is great because some people who are more round, we want to create that heart shape.
Mm-hmm.
I think that's lifting beautifully. You can see a difference underneath there. Turn this way. Good. Thank you. Gosh, what else about Voluma? Voluma.
Well, you have a new technique.
We do have a new technique with it. We'll film that next week or the following week, probably. Or maybe we don't have Kim on the schedule yet. But
We're pretty excited about it.
We use a micro cannula to give, and Linda doesn't really need it. That's why we're not doing it. But it gives a little more volume through here. And so it's been fun to do. It's always fun to have new techniques, and Nicole's been in the room helping me with it. And it's been, I've really liked the look.
I'm just going to have you fill up my whole
That's
neck.
right. We'll just fill it
fill up
all
my
up.
whole neck.
That's right. And that, that's the part that does bother you. And you said you've seen quite a bit of change with The Secret.
Yes, that's why I keep doing
the treatment.
it.
Yeah.
Because I never wear a V-neck or anything before.
Yeah, and it'll be interesting to see after this Voluma, especially since it hasn't been a year yet, but after this Voluma, how much lift you get. We had before and afters on a picture, or on a patient a couple weeks ago. I could not believe the lift. And how many Volumas did we do, Nicole?
We did 3
We
on
did
her.
3, but
Yeah.
she needed it. But oh my gosh, the lift was incredible. I couldn't believe it. That's what I love about Voluma is you can see results immediately, and you get just results everywhere. And that really does look good.
Yeah.
This is looking beautiful.
And I'm the biggest baby ever. Remember,
She
the
is
first
the big
time
baby,
I
yeah.
am a big baby. I am. I made her. The first time I did it, I was like, "No, we got to stop." And she's like, "No, we can't." I'm like, "I think I'm gonna faint. I'm gonna faint." I should get water and ice for me. And now I'm like,
Look.
it was nothing.
It's the anxiety of it all. I get it too. I mean, it's scary, and one, you don't know what you're going to look like.
Right, you don't know what you're gonna look like.
And two, if you don't like pain, it's scary. I love it. Okay. But look, you've come a long way.
I have. I'm a big girl now.
That's right.
In more ways than one.
No.
COVID, darn.
I know. Okay, relax. Come right in here. Besides our TNS, what would you say your favorite product is?
HA5.
Okay.
And the Total Eye.
The Total Eye. Yeah, I love the Total Eye. Turn towards me. Good. I'm going to come back to the other side. We'll do just a touch
Of course,
more,
I like
and
them
we're
all,
done.
but then I'm into the Total Glow, the glow thing now.
Mm-hmm.
And I love the balms. Of course, I melted mine also.
Oh, no.
Oh, I left them in the car, and they're all like smushed, but I still use them.
Do they still work? I will give you some new ones.
No, they
Oh
still
my
work.
gosh.
No, I'm not wasting them. No, they still work. They
Let
just-
them
I tried.
become a solid again.
Well, they're solid now, but I tried to smush them back in, and so they're
gosh.
ridiculous. But they work, and it goes forever. I'm not
Yes,
wasting it.
a teeny tiny bit goes a long way.
Yeah.
Okay, turn towards me. Now, put your chin down to your chest. And lean forward just a touch. And now put your chin down. I want to show the camera. So you can see that she needs just a little bit more product in here. She's pretty good here. You can see that little scar. But I only have a little bit left. So now we pick and choose where we need to go. And this is where it needs to be. But if you look at her cheeks are great. And I actually think I think you were a little heavy through here, and this has really pulled it back as well. So, okay. So our last little bit for cheeks will go right here.
Okay.
Get my arm. And I think, there's definitely an art to injecting. And as you can see, I take my time, sometimes too long, but I want to make sure that we're hitting all the right spots. So go ahead and lean forward again and chin down. So she could probably use a touch more in there, but I think her Secret RF is going to continue to lift up. And we may, in a few months, we may want to put a touch with our microcannula in here. But let's see how this settles in. See if you can tell.
Oh yeah, it did lift it up. Oh, great.
Yeah, I think it looks good. I think underneath it, your eyes looks better.
I know, wearing no makeup is really...
It's tough being on camera, isn't it?
Yes, with all these lights.
Yeah,
Like, oh.
but really take a look at your skin, and overall, it really looks good. You don't have a lot of hyperpigmentation, don't have a lot of lines, and we're going to do some Botox today too, but I mean, really...
Yeah, no,
You look pretty damn good, sister. Okay, so now we're going to move on to our lips, Volbella, and Linda has little bitty baby lips. And so we want to keep them little, but we just really want to give definition and give a little bit of oomph to them. So I'm choosing Volbella because it's the thinnest product that we have. And the thinnest product that we have, so it's not going to, thank you. It's not going to, there's no way she could be overdone, even if I put the full syringe in, which we usually don't. We usually do about a half a syringe. Okay, you ready? And we do feel the lippies a little bit more. Okay, open just a touch for me. There you go. There we go. Good. And again, she has a little bit of numbing on. That numbing works pretty darn well. And you can already see just that little bit of a point. Good. Then go ahead and close. And so can you see I mean, it's a teeny bit, but you can just see just that little bit of definition over that side. That, I don't even think that was 1 cc. I mean, it's just a teeny tiny amount. A little bit more in the center here. And again, aspirating each time just to make sure we're not in any vessels. Injecting very slowly, which also helps with pain or no pain, trying to keep it. So there you can see a little bit of a difference. Now, I think she could go a little bit bigger, but let's see what she thinks. And obviously, we're not done.
I'm going to let you choose.
Woo!
I know, I'm being brave.
I know.
I know. Because I see my daughter's lips and what mine used to look like, and I'm like, oh, her lips are beautiful.
So this is a change, people. This is totally different because normally she's like, no, I think it's good. Okay. And what's interesting is once we go, I always say we go all the way around the lips, and it may be enough, but I do think we can do a little more. So, okay, open just a touch. everybody's so afraid of doing lips because you see the movie stars and you see,
Yeah.
you know, how awful they can be because they're too big.
Over-exaggerated, yeah.
And somebody like Linda who has little lips anyway, you really cannot give her those big round lips. It's just not possible. Because it'll look ridiculous. But she has a tendency, she could go to, you always hear duck lips.
Mm-hmm.
And because of the way her lips are shaped, if we overdid her, she very well could have duck lips. So we do not want to do that either.
Yeah, because mine tend to go out.
They go out, right.
Mhm.
So they're more like flat this way.
Mm-hmm.
Turn towards me. Very good. You doing okay?
Yeah.
Okay, great.
No problem at all.
Good. Okay, so let's go to the bottom. But the beauty of really any of the Juvederm products that we use in the lips is that if you're in the right hands, you're not going to have overdone lips.
Right.
It's just not appropriate. I'm so ready to have mine done. I think it's been almost 4 years now, hasn't it, Nicole?
It is.
February, I think, will be 4 years. That's crazy. What's that? Sure, thank you. Actually, we'll come to that side anyway. Ooh, now that's looking good. See, so now we have a little, more in her bottom lip. So we absolutely have to go to the top. But I am loving that bottom lip.
Oh, good.
Yeah. Okay, so let me throw this away. Oops, I'll switch sides. Thank you. All right, I'll take that alcohol too. Thank you. Oh yeah, that looks good.
Good. I'm tired of being at home and being a hermit.
That's
I
right.
mean, we need to do something fun
That's
for yourself.
right.
Mm-hmm.
Okay, so let me put a little bit more in the. What's that? They do dry fast, yeah. So sometimes these videos are a little boring because, it takes a little bit to get where we want to go, but
Quiet time.
that's right. That's why I enjoy my music. Okay, I'm gonna go back to the top. And then we'll put before and afters up so we can see the difference too. Okay. And you can see she's got a little bruise coming up, and that's normal too. Bruising lasts the same as if you had a bruise anywhere else. It's going to be up to 2 weeks. The good thing with the lips is that usually you can cover it up, like she was saying, with her beautiful lip balms that she uses, which have an SPF, I think, 35 in them.
I thought they were 50.
Oh, they might be 50. Yeah. Look at you.
You kid not giving us so many gifts.
I know.
Like, use them.
Yeah.
Protect your skin.
That's right. Good girl. Yeah, I'm liking that. So you can see the little bruise there. Open just a touch for me. So it looks a little uneven, but that's all going to settle in. We come to the other side. We'll get the upper. And then what we'll do with the rest of this is put it down in her lines. We'll do a little bit on the top too. Open just a touch. Actually, I'm going to need to put a little bit more on that side. On a scale of 1 to 10, 10 being the worst, what would you say for pain on your lips?
2.
2? Okay, good.
Yeah,
Good.
it's very. I mean, when you put it in, you can feel it a little bit, but then it's
Little
yeah,
pinch.
yeah, but that's about it.
Good. Okay, turn right back to the other side, and then we'll just add a little more there, and then I like them. So see the difference now, because before her lower lip looked so much bigger, but now that we've added a little more to the top, they're more in proportion. And they're still not huge by any means. All right, I'll take that, Nicole. Thank you. We're getting our exercise.
Get your steps in.
That's right. Okay, open for me. And chin up just a touch. There you go. Okay, let's see. Open just a touch. Still just a little bit off. And with Volbella, one syringe, I usually say 6 to 9 months. Yeah, that looks good. 6 to 9 months is when you want to repeat it.
Oh yeah, they look very natural. That's good. Because you know that's my big
That's
thing.
your big thing. That's my big thing too. So
Yeah,
what do you
that looks
think?
good. I like them.
I like
them
the
a lot.
size. I mean, I don't think they're too big. I don't think they're too
No.
small.
I like them.
Okay. Yay.
I like it a lot.
Good. And probably a little bit of swelling, but overall, not too bad. So now what we're going to do are the corners of
Yeah.
her mouth. Yeah, I really like the size. Can you tell on their stuff, like a difference?
I think you'd never even know if I didn't.
No.
If I didn't know you,
Yeah,
I
if you
would
didn't
walk
know me.
by and
Yeah.
wouldn't
Yeah.
know anything.
And
And
I'll
I'll put her pictures before and after down below in the comments.
Yeah, and what I like is, you know, because she had such small lips, really her cheekbones were extremely overwhelming. Not extremely, I shouldn't say that. They were overwhelming, and then now you look more proportioned.
Yeah.
You know, that's really what it is proportioning. And I always tell everybody it's more like camouflaging. It's not, we might not fix exactly the point that you came in for, but you work around it, so. Okay, you close the, yep. And these deep lines that she has coming out, you know, around the corners of her mouth, that's going to be more product and secret RF. There's really no way for filler to completely get rid of it,
But it helps.
but it does help, and it definitely softens. And what we're doing is just giving a little bit of support for the corners of her mouth, and then she won't have as much downturn lips, which already, look at the difference there.
I don't want that RBF.
No, you don't want that at all. That's bad, yeah.
It's bad.
Yeah.
And I'm not that way.
No, you're not. Not at all. Okay, so relax for me. Yeah, so you can see how this one's coming straight out. This one's still coming down a little bit. Now what I want to do is work on this little deep guy over here. See if we can't get it to soften somewhat. It's really about, when we're doing this, it's like we're trying to airbrush. We're trying to go around and soften all of our little lines. All right, I'm gonna come back to the other side. Thank you. And she really doesn't have lines here, but she's got a little bit there, so we'll come up and do that too. Okay, let's get your corner. Okay. That's good. You know, and this is a part of her smile line, so that's another reason why we'll never really get rid of it all. But by softening it, it just will make it look a little bit better.
Tracy says hi.
Oh, my sister? Oh.
Hi, Tracy.
I see her picture over there. She's going to see me tonight.
Yeah, her pictures are just outstanding.
She had the best result of that
The
pearl.
pearl, yeah.
Oh my gosh.
God.
Yeah, that's why we put those up there. I'm gonna just stay. I'm gonna
it's amazing,
switch
yeah.
this. Just switch my needle real quick. But I'm gonna go back over there. I know the best treatment you could ever do for your skin, for the deeper lines and for pigmentation,
I think it
is
made her
the
look
pearl.
10 years younger.
I think so too.
Her skin has never looked that good.
Yeah, I think I was just glad that she was willing to, to actually do it and take care of her skin now. And of course, she's on all the skincare. She's still on there. We're talking about you, Tracy.
Yeah.
She's able to maintain it. And we did some filler too, which was nice. I'm gonna go on your upper lip here just to give a little bit of support for these little guys. So she has just a little bit of fine lines up here, so we're gonna add a little. And what's nice about the Volbella is that it just melds into the skin. It just mixes in beautifully. So she'll see a little more plumping over time. And this is what everybody wants, these fine lines to go away. But in the end, that does look a little bit better, but in the end, it's more about the Secret RF, the skincare, that kind of stuff versus the just filler alone. But you want to do collagen stimulation beforehand, so that's why you got your 3 in.
Yeah.
And then you'll probably want to do some more Secret in 3 to 6 months. You could do it quarterly, you could do it annually. I feel like there's not enough collagen stimulation. I could do it like monthly still and still be like, I want more. I think that's softening that up nicely. Good. Okay, I have a little bit left, so I'm just going to come back down here. I'm just going to put a little bit in the chin area, and what this is doing is just blending her jawline a little bit more, because even though it's not lifted completely, it's definitely better. But by adding just a little bit of product, it again camouflages. That's my word today, camouflage.
Oh, my mom had it, so with jowls.
Yeah, and probably what I should have done too, but sometimes when you're only doing 1 syringe, that's why 2 syringes is nice, because you have a little bit more leeway what you're doing with Voluma. But next time we can put a little bit here too, and that'll give us some lift.
I wondered if you could do that.
Yeah, and I probably should have, but you needed it through here. So,
Right.
So again, that's why you think 2 is a lot, but 5 syringes is 1 teaspoon. And so when I say you need, you did 2 today. When I say you need 3 syringes, you're thinking, oh my gosh, that's so much. But it's, this is the syringe. It's this teeny little amount. And it's about the placement of it. So people like you, we just do it a little more often. Okay, there we go. Good. Do you mind just
let me
wiping
wipe
her? And then I'll get her Botox. Now with Linda, she barely does any Botox. She really doesn't need that much Botox. And that's the beauty of Botox, is that less is more with that as well. So we don't even do it every 3 months. I mean, she's like so lucky. I do mine every 3 months without missing a beat, because my Botox, I need a whole lot more. I mean, I think we're doing...
But I think it's because I've done it
It could be.
for
Yeah,
years.
so,
It's just,
I mean,
yeah.
she's half the amount of what I do, which is great. I'm going to let you if you don't care. Yeah.
Give that to you, and then you want glabella?
Yeah, we'll do glabella.
And I think your audience should know I'm 60, almost 61. So I think you really help my skin.
Good.
I'd rather do this than get a handbag.
I love it. I love it.
That handbag, it'll be gone.
And that's what, it's funny because you prioritize
I
what
prioritize.
is the most important, and I'm with you. I would be prioritizing this as well. So with all of the things we've been talking about today, we have a membership program which helps with the cost of everything. And we can create a treatment plan, and then you can pay monthly for it. So we call it budgeting your beauty out. And then you know exactly this side. I know, and I barely put anything in.
I know.
So with Botox, you have the chance of drooping down. So we've done her forehead in the past, but almost every time she's a drooper. I mean,
I'm a
it
drooper.
just is, you know.
Only
and
one
so,
side too.
Yeah, and the minimal amount will set her off. So again, why we don't do a whole lot. And it can happen. Let's do this eyes, crow's feet. Okay. It's 3, 3, 3, 3.
Yep.
Okay. Smile real big for me and relax.
12, 3, 3, yeah. Couldn't do the math.
I know.
Counted 9 in my mind. No, that's not right.
And smile real big for me and relax. Okay. Thank you. All right, and our chin. So this is relaxing just the chin muscle, which helps with the texture down here. Thank you so much. It's one of my favorite places to have injected. I just love how it relaxes my chin so much.
I have that deep wrinkle there, or I did.
Yeah. Okay, you want to hand her the mirror, please? See what she
That was
thinks.
quick.
Yeah, Botox is fast. The filler takes a little bit.
I think it looks good. It just makes not worrying about makeup and everything so much. You know.
Actually, I'm going to give you this. I'm just going to rub one more time. So
Very easy gal.
you are, make sure we got that all done. Open for me. Good. So I'm just making sure everything is nice and smooth. She has a couple of little pinpoint bruises, but really I don't think that those are going to go get any worse. We do have arnica here, which is a homeopathic remedy that helps to reduce the swelling and the bruising. And then we also have a color science corrector palette, which can cover tattoos. So we use that a lot after filler. Hopefully not a lot, because hopefully we don't bruise too much. You know, but when people do bruise, we do have that option to help with the bruising and covering it up. As I mentioned, the Botox Club is an excellent way to save money on Botox, and you can do it with your skincare, with your fillers, really with our Diamond Glow, with anything. And so we really love helping our patients budget it out, save some money, and actually in the end probably get a little bit more and better results because they're being consistent with their treatment plan. So if you have any questions, if you want a consultation for filler, give us a call at 618-288-9117. Thanks so much for watching.